What did you say?
This is what you're going to look like.
Is that what Mummy's going to look like?
Yeah.
Yeah. Why?
Because your hair will fall off.
My hair's going to fall off?
Yeah.
What's going to make Mummy's hair fall off?
I don't know.
Can you remember?
No.
The special
Medicine.
The special medicine. And what's the special medicine going to do to my body?
Get all the seed out.
Yeah, get all of the bad cells out.
Yeah.
Yeah. So I had my blood test. I walked in and there was nobody sitting in the reception, so I thought this is going to take forever. But there were also no patients in the main waiting area, and there were a couple there's like another little one where you walk through. But my blood test form was faxed through. The guy that did my blood test, he was a bit, I don't know, odd. But good, I don't know. He was able to get my blood without a problem. I had a CT scan the other day, so I needed to get that contrast dye put in, so they used my left arm for it. So I said today if maybe we can use the right arm, but he couldn't find any veins, so he had to use the other arm again. But that was that. The whole thing took 10 minutes. Now know that about 10, maybe even 9 will be good for future blood tests. So that was a blood test, and then now I am sitting a lady looked at me just weirdly. Anyway, now I'm sitting at the doctor's because I am also going to get my first Pfizer vaccine today, because it was highly recommended that I get the COVID vaccine, and the first one being before my first chemo. So I'm hoping that's all going to go okay today. I'm kind of not looking forward to it, but I'm sure it'll be okay. I've been warned that I might just get a very sore arm, but I've been told that having the vaccine this early to the chemo will be fine, but I don't know. That's about it. I haven't updated on the scar. The lighting is not very good at the moment, but it's doing pretty good. The actual incision, I think, is obviously completely closed now. It's still got a bump, but my neck all still has this weird feeling in it. Like when I run my fingers over it, it feels like, you know, when you're laying down, you get a dead arm, not pins and needles, just that kind of like heavy, prickly kind of feeling. But yeah, that's that side of things. So I think obviously that's healing pretty well. And yeah. So in relation to obviously the chemo, I'm kind of excited, which is maybe a weird feeling to have, but I think it's been so long now since I had my first x-ray, which led on to everything else, that I want to get started now. I don't feel scared or anxious about it. The only thing that I feel like I'm more anxious about the COVID vaccine than chemo, but I'm a little bit nervous about the IV, because I've heard that on some people it can sting and hurt a little bit but if it's anything like a general IV, it should be fine. However, they said that generally they save like this area of your arms for the blood tests that you need, and the IVs go in this part of your arm. So I don't like the thought of that, but gotta do what gotta do. And then also, if tomorrow doesn't go well with the IV, I think I might, well, I'm already kind of considering, but the PIC line, just to make future blood tests, chemos, and any potential transfusions that I need, or infusions later on in the track. Anyway, I'm gonna stop talking now because I feel very strange. I currently have my phone stuck to my window in my car, and yeah, see you later. It's now 11:30 at night, but just about the COVID vaccine. Everything went well. I was in there for, I think, about 20 minutes. Well, I waited for a little while, but the whole process of the vaccine took about 20 minutes. Had a few questions with the doctor. She had to go through some stuff, and then she was very interested about the lymphoma and my little scar on my neck. Anyway, she jabbed me, didn't even know it was coming. Before I knew it, she had a bloody needle in my arm. But anyway, then I had to go and sit in a little waiting area for 15 minutes because there's a small chance of anaphylaxis. I haven't reacted to the COVID vaccine. I just have a very sore arm. Like, I can't lift it very well, and it just hurts. I feel like I've been punched in the arm and the pain is just not going away. So it'll be interesting to see how long this lasts. But anyway, got home and I got my lymphoma parcel, or my parcel from Lymphoma Australia, so I get to wear my things, and I've given some bracelets out to some of the family. What was I going to say? My older sister and I did a big clean out of my room, so now everything's nice and clean. I think that's about it. My brain's not working anymore. I just watched my previous video from this morning as well, and I'm just so slow and I forget what I'm talking about. And this is pre-chemo. What the hell am I going to be like with chemo brain? I feel sorry for everybody that has to talk to me. Anyway, so yeah, excited about tomorrow. I've got my mum coming with me for, I don't know, she wanted to come. Hi mum. But yes, packed bags, so I'll be taking my Switch and maybe a cards so that we've got something to do. But yes, so earlier when I was saying that, like, it's been a long time or whatever, my first x-ray that led to everything was on the 9th of July, and tomorrow is the 9th of September, and it's just kind of, not funny, but funny, coincidence, I don't know, that it's exactly 2 months after my first scan. So that's kind of cool, I suppose. Yeah. Anyway, I'm gonna go to bed now because I'm a little bit tired and have to be awake early to obviously go to the hospital. But I will try and get some videos tomorrow, and anyway, good night. first chemo day. I've woken up, gotten dressed, got in the car. It's a rainy day outside, nice and cloudy. I don't mind the rain. But anyway, I've got Mum in the car with me. Hi. And we're about to leave. See you later. So we made it today. Took us over an hour to get here because traffic was just absolutely horrendous. But I got here, got parking. That was brilliant. There were so many bays. Currently sitting here in a nice rocking chair whilst I wait to be called in. So, see how it goes.
They say you can do it over 5 minutes, but each of us were taught a different way to do it. I do it so when I squirt a bit, I wait for it to sort of go in before I squirt the next bit and so forth. But yeah.
I can see what's going on here.
How can you, Jane?
Yeah. Got my own personal television.
Yeah. And the reason we do it by hand, this one's the one, like I said, if it's not in the vein, you can eat the surrounding tissue. So by doing it this way, and you're only pushing it a little bit, if it does happen to come out, then we can see at an instant sort of notice that it's not enough and draw and sort of stop. Rather than have the pump it in and pump like a lot in before it's noticed. So.
So do you have to do this one as slow as well?
Yeah, do this one a bit slow too, just because they say that if you do it slower, it's less damage to the lungs. One's going to go in slightly by gravity.
Does any of these have to be kept in the fridge or anything?
They do when they come over from pharmacy.
Yeah.
So initially they've all been in the fridge.
Right.
But as soon as we start giving them, no, we don't keep them in the fridge.
Yep.
Yeah.
What's that?
This is the pump loading it all up for so it'll pump the. I have to pop it in there.
Or
This
an
drug
orange?
is light sensitive.
Okay.
The others are fine with the normal lights, but this one is, even the lights in here are just too much for it. So they put it in a
I can feel it going through. 27 minutes left. Good evening, everybody. Just a quick recap of today. Obviously got there. When I went in, I got into my chair for the few hours that I'd be there, and I had a big chat with the nurse as she put in my drip. So the drip was in my forearm, which I've never had a drip in that area before. It's always been like in the elbow crease or in the hand. However, I did have one here when I had Hazel. And then I had to wait about an hour and a half to see my doctor because they didn't want to start any of the chemo before the doctor got there. But everything with the doctor went fine. Spoke about some drugs that I need to take at home. So one's for like nausea, the other one is for like mouth bacteria to prevent any of that, and then the other one I'm on just for 10 days, and my understanding at the moment is just to help flush out a bunch of shit at the beginning for 10 days. So that's that. And then anyway, basically it was time for chemo. So the first drug, which is the red one, the nurse sits there for about 10 minutes and slowly injects it with her hand. And then the next one, which is the bleomycin, that's a clear one that goes straight. The syringe as well sits there for another 10 minutes. And then it's the vinblastine, and that one is a small drip or a smaller bag that's up on the thingy, and that I think lasted maybe half an hour to 45 minutes. And then it was time for, the dacarbazine, which is the last drug, and that one, it's in an orange IV, because it's light sensitive, and also the bag itself was covered with a red bag on top because of obviously the light sensitivity. So that one took an hour, and she hooked that one into the little machine, and had to put in the name of it, how long it was going to be, how much was in the bag, and blah blah blah. So yeah, that one was an hour. That one had a chance of like a burning sensation in your veins, and it could be quite irritating. As soon as she put it in, I think for maybe like a minute or two, I knew it was going in. The other ones just kind of felt a bit cold. I could feel something going in, but this one, it felt like my arm was like hot and prickly. Like it didn't burn as such, but it was just like an intense kind of hot and prickly sensation. I don't really know how to explain that. But then after that it was fine. I also got a heat pack for my arm, which is what you see in the video, which helps the veins and the drug to kind of go in a bit easier. So that was that. Had to wee many times today whilst I was having all the drugs. Also alongside each drug I had a bag of saline and something else. Filtering through chloride? Something? I don't know. Yeah, so then every time I had to go to the loo I had to take my little pole thing with me. But that was that. And then, so that whole thing, it started at about 10:30 and I finished at 12:40. So it took less time than I expected. The actual chemo thing. But anyway, yeah, and then I had the prescription, so I had to wait to go and collect them, and then when I went back to see my nurse, we then had to do the fertility injection that I mentioned. So that, I thought it was just a shot that you get, but you actually get this tiny, one of them said it's like the size of a rice grain. So an hour before they gave me the injection, I had to put some numbing cream on my stomach, like on the lower half, and then they inject you, so it's like a normal length needle, but it was quite thick. But yeah, so that goes in, and then the little rice grain implant basically will last for about a month, or will last a month, and it will just slowly release off hormones and things to put me in that temporary menopausal state to kind of help save my ovaries and stuff to better preserve fertility for later. That one stung a little bit. Like the needle going in didn't really hurt, but the actual, when I felt the implant go in, that one I could feel. And then after that, I went and saw the youth people and just had a brief chat with them. I went and saw the puzzle. There wasn't much progress on the puzzle. And then it was time to go home. So at this point, I was still feeling pretty good. I had a very big hot flush in the youth room, to the point where I was just like sweating profusely. So I don't know if that was related to the chemo, if that's just part of my normal hot flushes, if it's part of the COVID jab I had yesterday, I don't know, but it wasn't pleasant. But anyway, I got home, I had a little something to eat, and then I started feeling a bit gross and nauseous, so I napped for an hour, woke up, still felt quite nauseous, but I had a little bowl of spaghetti about an hour ago, so I don't feel terrible right now. I just still feel a little bit nauseous, but not too bad. I'm just very tired, as you can see. I feel like my eyeballs looked tired this morning, but yeah, that's it for the first day. Oh right, we also spoke about the PICC line again. So ideally it would be the safest option in terms of like infections and things would just be to get the IV in the arm that they do every week, because the PICC line, because it's got to stay in the whole time with that constant like little breakage of the skin where the cannula goes in, it's got an increased chance of infection. And then I just feel like it's going to be very impractical with a 3.5-year-old, and the fact that it's got to be like bandaged up so the dangly things don't, I don't know, catch on anything, and then showering and all that get wet. But then the idea of not being stabbed 1,000 times kind of feels nice. But so at the moment, I think I'm just gonna stick with the IV because today went reasonably well. And that's it, I think. I don't know. I think that's it. I'm sure something will come to me tomorrow morning if I forget, but that's it. I'm going to bed now. It's the morning after my first day of chemo, and I thought I'd sit here and talk about things that I didn't mention yesterday. Can't really remember what I even mentioned in my video last night, but we'll do that. Also have some toast because I think I'm hungry, and I've got my medications that I had to pick up, so I thought we'd start with that because that's what I need to do first. So I was given all of my drugs and a bunch of information on the drugs. Okay, so the first one I've got is called allopurinol, and allopurinol is used to treat gouty arthritis or gout, kidney stones, and rare conditions where high levels of uric acid occur in the blood. So I've got that to take for 10 days, once a day. And then I have metoclopramide, and this is used for nausea and vomiting, delayed gastric emptying, migraine with nausea and vomiting, and it's thought to work by stimulating movement of the upper gut and interfering with pathways of the vomiting reflex in the brain. That one. And I also have valacyclovir, and this one is used for the prevention of viral infections in patients who are immunocompromised and patients who have had chickenpox as a child or cold sores can get shingles or a reoccurrence of their cold sore when their immune system is depressed by chemotherapy or immunosuppressant medication. So it aims to prevent herpes simplex virus or shingles and cold sores in these at-risk immunocompromised patients. And they are in this box. So let's have our first concoction of drugs for this morning. But that's that. They are pills for today. Oh, also, we haven't got any bread, so I'm having a bun cut in half, which is pretty good. If you haven't tried it, try a bun for some toast. But anyway, I don't know what else is left to say about yesterday, but it all went okay. I felt pretty crap last night, actually. I was fine for a couple of hours after the chemo, and then when I got home I just was tired and nauseous. So I'm hoping, I don't know, I'm hoping it stays like this for the next couple of days, and then I feel better because I don't have Hazel in my care at the moment. So I planned that so that hopefully, if it did happen like this, I won't be responsible for Hazel whilst I feel like this. Oh God. Clearly my brain is just not working. I did have a good sleep last night though. I went to bed about 9:30 and then I had to wake up at 2 because I needed the loo. And then I woke up at 7:30. So good few hours of sleep. My nurses yesterday were lovely. There are a few things I forgot to mention. Not that they're very important, but I don't know if you're interested. So the fertility needle that I got yesterday, the little rice grain size thing I was telling you about. So I've also got an information sheet for that one. And it reduces the level of estrogen and is used in combination with other drugs as part of the treatment for infertility. So my understanding of that was basically it puts my body into like a temporary menopausal state. So with that, where did I read it? Basically, I will probably have some symptoms of menopause, which sounds fun. So yeah, before they gave me that injection, I had some numbing cream on my belly. I remember saying this now, and then I had to wait an hour. But anyway, so that gets done once every 28 days. So I've been given the numbing cream, and it's an IV band-aid thing that you put over the cannula, but so cream on the belly, and I put that on top of it just so that the cream stays there and it numbs the area. But that's that. And then in my little pamphlet, I've got a letter. It says, "Dear attending doctor, this patient is receiving chemotherapy for a hematological malignancy. They are at risk of febrile neutropenia. If they develop a fever or feel unwell, they have been instructed to present immediately to the emergency department for assessment. They require rapid triage and clinical assessment with a view to administration of intravenous antibiotics. The following procedures should be followed." So rapid triage, the clinical assessment, blood tests, administration of broad spectrum antibiotics, other tests that will be clinically indicated at the time, and the treating doctors need to call the on-call hematology/oncology registrar. It is important that patients who are at risk of febrile neutropenia and present with a fever are processed as quickly as possible with a view to early administration of the antibiotics. So if I have to go into ED, I need to take that letter, but if I forget the letter, I have a handy card that I can keep in my wallet, which has my name, my patient ID number, and my consultant's name. Oh yeah, so here on my card it says, if you become unwell with a temperature higher than 38, go to your nearest emergency department ASAP. So that's fun. Diet wise, I've been told that I need to have basically like a pregnancy diet. So I've got a little pamphlet about listeria and food and advice for people at risk, which is now me. But it just talks about what listeria is, how to avoid it, good food hygiene, and then on the back it's got a table of some examples of some higher risk foods. I also have a patient passport, and then in this book I can write a lot of information about myself, the diagnosis. I can record my weight, because there's bound to be weight changes, my chemo regimen, any allergies I have, blood results, some side effects. I think that one's quite cool. So you've got side effects, and then I've got all my cycles there, so I can just tick what side effects I do get, which is, I think, a great way to know what side effects I have. And then I've got space to journal, basically. So please write down any physical, social or psychological side effects that you may have experienced between chemo cycles, and a place to write questions. And a lovely map of Charlie's. That's that one. I've got a blood test form, some information on treatment for episodic constipation. And then this is the last thing in there, and it's neutropenic precautions. So things that I shouldn't do and should do. So go to the ED if I have a temp over 38. Avoid infectious people. So anyone that comes to my house, please be well. Use a soft toothbrush and no flossing, because gums and bleeding, some of the medication can affect like the clotting factors in your body. No gardening, including lawn mowing, because there's lots of like little things in the garden that can affect me. Pets are okay, but I'm not allowed to clean litter trays, which is good because our cat Smokey, he goes outside. Avoid using tampons. Wash hands thoroughly and maintain good hygiene. Drink at least 2 litres of fluid per day. Follow a neutropenic diet, so that is that one again, and it's got no fast food in brackets. Avoid heavy cleaning and dusting. So my older sister has already said that she's happy to help me with that. No caring for birds and avoiding crowds. So that's my information sheet. Yeah, so now I think I'm okay. Now I think I'm done. I don't think I have anything else to report. But I think today I'm feeling a bit exhausted, I think, and I didn't finish my toast bun because I feel a bit icky. But hopefully the nausea medication kicks in, and I'm just gonna go chill out and not do much. Gonna have a shower and then chill out. No, I'll probably just chill out because I don't want to get in the shower yet. Probably fall over. Okay, anyway, I'm going now. Hopefully you don't see me again soon. Bye. Hi. So it's been quite a few days since I've been on camera and spoken to everybody, but it is Sunday. I'm not sure what the date is, I can't remember, but anyway, I basically had quite a rough last week, 10 days, whatever it's been. So obviously I had chemo on Thursday, and then by Thursday evening I was just tired, and then Friday I woke up quite late and didn't really eat much. I ended up doing that video where I went through like all the medications and stuff. And then Saturday I started feeling really crap, so my mouth had started hurting, and then by Sunday I was just in a lot of pain, to the point Sunday evening I was awake most of the night. I had 2 crying fits because of how much pain my head was. So my tongue felt like it was on fire. So think of the last time you burnt your tongue on hot food, but imagine it on literally every single section of your tongue, like everything of your tongue. My lips started to get really dry and felt quite puffy. My jaw started to tense up and get really crampy, as well as my head. I had just like really bad headache that wouldn't go away. So that basically got very severe by the Sunday night, and then on Monday I contacted the youth people, who then got in contact with one of my nurses, who basically said to either go to the ED or go to the clinic. So I ended up going to the clinic, where they basically prescribed me oxycodone for the pain, as well as lidocaine, which is a mouthwash for the mouth. Anyway, I started taking the oxycodone, well, some of them. I didn't want to take too many, but took those, which helped with the pain a little bit. And then the mouthwash, I ended up doing that once, which numbed everything in my mouth, even my lips. Everything just felt quite funny. But that all helped, and then that all started getting better by, what's today, Sunday? Maybe Friday, I started really feeling okay again. And then the whole time that my head was in pain, I was also quite constipated. So for about 5 days, I didn't go to the loo, which then obviously was quite painful in the stomach area, which I then also think contributed to like headaches and things. Appetite wise, I didn't really eat too much because I wasn't feeling very hungry, but then on top of that, my tongue, like everything that went into my mouth just hurt my tongue. So it hurt to eat, it hurt to drink, it hurt to talk, so I couldn't do any of like my videos. So that was that. Apologies if everything's just kind of doesn't make sense. Just trying to remember what I did the last week. Yes, and then when I spoke to my nurses at the hospital about all of this, when I got prescribed the other things, they said that what has happened to my mouth and my head and my jaw doesn't usually, well, it happens, but it's not a common side effect of having the chemo. And she is hopeful that it'll only be for this first treatment, so the first cycle. So I'm really hoping that the next chemo, which is this Thursday, doesn't do any of this to my head, because it was awful. Like it was awful. My tongue now still feels a little bit funny. My lips aren't too bad, they're still a bit dry, but the crampiness in my jaw is pretty good, and my headaches, they've been pretty absent the last few days as well. But I think that's it. So yeah, just this chemo basically hit me quite hard. It was painful, didn't like it. I slept a lot as well. I feel like I was sleeping like 10 and 11 hours a night, and then napped up to 3 times a day. Yeah, so that's that. Yeah, I think that's it. Hey guys, so I was just in the middle of editing this video, and I wanted to mention a few other things that I didn't mention before. So obviously the first 10 days, I think, after the first treatment was horrific. I obviously didn't have Hazel in my care till, what was it, the Monday afternoon, which I'm so glad for, because I was just absolutely useless. But for the next few days, I had lots of support from my mum, my younger sister, my older sister, and one of my nieces, who also stayed over quite a few nights. So I'm very appreciative of their help, as they helped with taking Hazel to and from daycare, helped with tidying and cleaning, and just looking after Hazel for me. So I'm very, very thankful about that, and I now understand the meaning of it takes a village. So that was that. Another thing that I forgot to mention was, you can't see it now, but I also broke out all around my neck, under my chin was really bad, and I've still got a few around here of they were more of like a blister, so not pimples or acne or anything, it was like blistering, which were also quite swollen and painful. And then another thing that was also quite bad is my itching. My just around here and my armpits were, and still are, quite itchy, and then also my just above my ribs, or on my ribs, and in the middle of my sternum, as well as 2 areas on my stomach were just ridiculously itchy as well, to the point I now have dark pigmentation now around my torso, and up here isn't too bad. But I'm feeling very good today. So it's the day before my second treatment. So the last 3 days I've basically felt like myself. Other people are saying like, yeah, you're great, like you're fine, you can't even tell you're sick. And yeah, made the most of the last 3 days, ready for tomorrow so I can feel like shit all over again. But hopefully it's helping and getting rid of the shit that is inside of me. So anyway, that's it for this video, and I will document some of the stuff in the next one, and hopefully it's not as long as this one. So anyway, see you all in the next one. Bye!
Mommy, when you go to the doctor, you are gonna have your special medicine, and you still look beautiful. So beautiful.
Why did you say I'll still look beautiful? What will happen?
My hair will fall off.